Hello, everyone. My name is Priscilla Pena, and this is my public health presentation. So, the first step is what is public health? According to the American Public Health Association, public health improves our quality of life, helps children thrive, reduces human suffering, and saves money. This can include public health professionals and focusing on the population. The three core values of public health are equity, social justice, and community engagement. In the third slide, we have social detriments. For the second, we have economic stability, which is employment, income, expenses, debt, medical bills, and support. The next one is neighborhood and physical environment. That includes housing, transportation, safety, parks, playgrounds, walkability, zip codes, and geography. Next is education. This focuses on literacy, language, early childhood education, vocational training, and higher education. Then we have food, which focuses on hunger and access to healthy options. The next is community and social context. This focuses on social integrations, support systems, community engagement, discrimination, and stress. Lastly, we have the healthcare systems. This covers health coverage, provider availability, provider and cultural quality of care. Focusing on social determinants, we have from the Healthy People 2030 by just promoting healthy choices won't eliminate these and other health disparities. Instead, public health organizations and their partners in sectors like education, transportation, and housing need to take action to improve the conditions in people's environment. For positive health outcomes, we have the Healthy People Framework, and through measurable objectives. Healthy People highlights how conditions in the environment where people are born, live, learn, work, play, worship, and age significantly influence health. From a Christian perspective, it's important to continue to love and care for one another, as we are all God's children. It's important to speak up for those in need, to help protect and defend those who can't. We also need to encourage each other to help live our purpose and protect our health. For this slide, my Christian perspective, I wanted to focus on Proverbs 31:8. This focuses on speak up for those who cannot speak for themselves, for the rights of all. Are destitute, speak up and judge fairly. Defend the rights of the poor and the needy. In the next slide, we have the roles of governmental organizations. Both Medicare and Medicaid became major programs in 1965. Other government organizations include Centers for Disease Control and Prevention, CDC, Health Services Resources Administration, the HSRA, and National Institutes of Health, the NHI. Each of these governmental organizations focus on insurance prevention and the safety for the public. Next, we have local government. This focuses on special purpose functions. These include emergency medical services, EMS, education, utilities, and community services. For state government, I decided to focus on a quote which states police powers played big roles eliminating actions of individuals. Over the years, this has protected the states by protecting the citizens of the state. After 1935, states eagerly sought out federal funding for maternal and child health services, public health laboratories, and other basic public health programs. Some of these include state mental health and substance abuse, state immunization programs, state public health laboratories, and focusing on people's health. Next, we have non governmental organizations. This can include American Red Cross, Save the Children organization, Planned Parenthood, and the Carter Center. Employers and businesses contribute to income to community residents, control workplace conditions, communities such as schools, churches, organize support for public health actions, and conducting research. Next, we can focus on the three core functions. The first is assessment, which focuses on collection of analysts and information, policy development, the process of sharing, consulting, and citizen participation to decide on public health issues, assurance, to ensure communities are healthy and protected. From the Goodwin University, we have, as they are the guiding principles that define the careers within this sector. Public health professionals have the goal of promoting, protecting, restoring, and improving the health of those around them. For significant events in public health, we have, starting with the ancient world, which focuses on sanitary amenities. Next, we have the Middle Ages, which focuses on the benefits of quarantine during the Black Death. Next is the Renaissance and Enlightenment, which focuses on the university development within the hospital. For the 18th century, we have vaccinations were created. Continuing on, we have the 19th century that focuses on social reforms and sanitary movements. The 20th century, which focuses on both Medicare and Medicaid, created in 1985. And the 21st century, which focuses on tobacco use reduction and global vaccinations. As far as achievements, I would like to focus on environmental achievements, impacts of vaccinations, and tobacco control. For environmental achievements, we have the Clean Air Act, created in 1963, and the Environmental Protection Agency, EPA, created in 1970. For impact of vaccinations, we have the success of vaccinations and other infectious controls such as HPV and HEB. Lastly, we have tobacco control. This focuses on the Framework Convention on Tobacco Control in 2003. Next, we can focus on impactful events. The use of vaccinations from Edward Jenner was the first to use vaccinations with cowpox to prevent smallpox in 1796. Next is the social reform and sanitary movement from 1830 to 1875. Next is the Medicare and Medicaid created in 1965. Then we have the Environmental Protection Agency. One current issue in public health I'd like to focus on is climate change. The impacts of climate change include increasing temperatures, extreme weather such as droughts, heat waves, and rising sea levels, wildfires, and human health. From the World Health Organization, some of the challenges and limitations is focusing on between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from undernutrition, malaria, diarrhea, and heat stress alone. These harsh conditions can interfere with food supply, increase in disease based on weather conditions, and much more. These are certain limitations in public health due to limited funding. This limited funding interferes with research for public health responses and actions. In order to overcome these challenges, we need to focus on one, raising awareness, two, providing incentives and awards, and three, establishing urban forestry, tree, and landscapes. For public health practitioners, we can use and focus on the essentials of a public health, which is included in Chapter 6 with 8 different skills needed. The first is analytical assessment skills, second, policy development and program planning skills, communication skills, cultural competency skills, community dimensions of practice skills, public health science skills, financial planning and management skills, and leadership and system thinking skills. Using these 8 skills encourages others to plan ahead and use these to the best of their ability. These skills can be useful and should be taken seriously to use for future needs. In order to accomplish these future achievements, in the next 15 years, I believe the most important achievement in public health will be prevention. In the next 25 years, prevention will continue to be more advanced and focus on different strategies to bring more awareness on multiple topics, such as climate change and other healthcare factors. These achievements will continue to increase research and strengthen the population. Thank you, everyone, for taking the time to watch my slides and my presentation. I hope you all have a great rest of the week.